So let's define diabetes. Anybody know what the meaning of diabetes mellitus? The word diabetes mellitus means, is a Greek word, means sweet urine. So a long time ago, doctors used to test the urine to see if the patient is diabetic or no. But the medical definition is a state in which you have high blood sugar over the normal average. Now, why it's important? Because we know high blood sugar over the long run, long time, it can lead to serious health issues. And it's about 24 million Americans have diabetes. From these 24 million Americans, about 6 million, they have no idea they have it. So it's very important to look for the disease and treat early. Now, when diabetes occurs, two situations. Either your body is not producing any insulin, like in type 1 diabetes, which usually occur in younger age, or your body is producing insulin, but is not enough for you as a person to control your sugar, or what we call it insulin resistance. And usually, typically, this is type 2 diabetic patients. Now, you'll ask me, what is insulin? Insulin is a hormone produced by your pancreas to control the sugar in your body. So normally when you eat, your body gives you a secretion of insulin to bring your sugar down back to normal. And then in between meals, you will have some insulin to keep your sugar within a normal range. So why we treat diabetics? Of course, the aim is to have normal sugar like non-diabetic patients. Also, we need to prevent complications. Complications either be short-term crisis, someone will come with very high sugar in coma stage, or symptoms of high blood sugar, going to the bathroom a lot, weight loss, tiredness, fatigueness, and to prevent long-term complications. As we know, I'm sure most people here, either they are diabetic or they know someone have diabetes, it affects every part of your body, starting from head to toe. Your eyes, your brain, your hair, your skin, your heart, your kidneys, your lower legs, I mean, everything. Everything in your body can be affected by diabetes. So it's really very important to control diabetes. And the problem here, these long-term complications, you won't feel them till it's too late. So it's really, we have to start treatment early to prevent these complications after 20, 25 years of diagnosing diabetes. This is just a picture of the first patient who received insulin in 1921. And you can see here on the left, these people usually they die within a week. Look at the patients like have no weight, no skin, not only skin and bones. And then when they give them insulin, a few weeks later, they're back to normal life. So really, insulin saves lives. This is just some numbers. There are 24 million people in this country have diabetes, 18 million diagnosed, about 5 to 10 are type 1, which means they have no insulin production, younger age group, about 99% about type 2, and about 6 million have undiagnosed yet. It costs about $132 billion every year, whether direct or indirect cost. Most of this cost has come from the complications, heart issues, kidney failures, strokes, amputations, blindness, hemodialysis. This is what really much of the cost comes from. So it's really important to control sugar, not only for your health, but for the sake of saving the economy these days. As you can see here, the older you get, the more likely you'll have diabetes. If you look here, between the age of 20 and 39, only 2.6% of patients will have diabetes. But if you go over the age of 60, almost 24%. So about 1 in 4 persons over the age of 60, they will have diabetes. And the older you get, the more likely you can get diabetic. Now, some numbers here. Every 24 hours, there is almost 4,384 new diabetic cases diagnosed. 195 amputations done every day. 128 people will become end-stage renal disease and they will become hemodialysis. 50 people become blind every day from diabetes. About 839 people will die from diabetes or its complication every day. So it's really a very serious problem.
Can I ask a question?
Yes.
What leads to the limb amputation? What about the diabetes leads to the limb amputation?
You see, diabetes, it can lead to a lot of complications. What will happen with time, this vascular supply or the blood supply will go slow, and these blood vessels will narrow and will occlude and will obstruct. It will lead, of course, no circulation or gangrenes, or sometimes they have bad infections. It can spread because of poorly controlled diabetes, poor circulation, and this will lead to amputations. Now, types of diabetes, there is type 1. About 5 to 10% of the population have type 1. It's usually a younger age group. It happens within a week or two. The patient, they're fine. Within a week or two, they start really feeling thirst, losing weight, dizzy, tired, comatose. They go to the emergency room, the blood sugar is 500. So it's short because the patient has no insulin. So within weeks, they will show up, usually within a week, sometimes even days. Type 2 sometimes can take 5 to 10 years to be diagnosed. Why? Because the patient will have slightly elevated blood sugar, 180, 200, slightly over normal. They have no symptoms whatsoever, maybe recurrent yeast infection, skin itching, dry skin. They go to the primary doctor, the sugar is slightly elevated, nobody pay attention to it, and goes for years. They estimate about the time of diagnosis, about you have diabetes for at least 5 years. So it's really, we have to be proactive and look for it, not wait till we have complications. Every now and then, in type 2 patient, their sugar becomes so high, then it will be diagnosed earlier. Their sugar goes up too high, they have to go in the bathroom a lot, they start losing weight, feeling thirsty. They go to the doctor, they check the blood sugar, it's high. Other than that, they may have no symptoms whatsoever. Now, gestational diabetes, from the name, it happens in pregnancy. About 5 to 10% of these patients, they end up having type 2 diabetes. Why it's important? Because it really carries risk on the mother, on the fetus, and in the future of the mother, even the fetus to have diabetes later on. They estimate about half of them, they will develop diabetes within 5 to 10 years. So nowadays, all pregnant women will be screened for diabetes. Now, what are the risk factors for diabetes? Of course, the older you get, the more likely you have diabetes. So age 45 or older. If you're overweight or obese, your BMI 25. If you have high blood pressure, if you have high cholesterol, if you have someone in the family has diabetes. Certain race or ethnicities like African Americans, Indians, Hispanics are more likely to have diabetes than white or Caucasian patients. History of gestational diabetes. If you have history of vascular disease, carotid artery problems, kidneys, stuff like that can lead also high risk of diabetes. If you have signs of insulin resistance, like darkening around your neck, darkening under the arms, between the legs, usually this is signs of insulin resistance and you may have diabetes in the future. Or as a female at a younger age, what we call PCOS or polycystic ovarian syndrome. They may have excess hair growth, irregular period, infertility. Or if they have abnormal sugar test in the past, or someone have inactive lifestyle. These are the risk factors of having diabetes. If someone has any of these, they should be screened for diabetes. So if you look at them, almost everybody have at least one of these. Any questions here? Of course, who else should be tested besides these? If a woman have a baby more than 9 pounds, that's a risk factor of having diabetes. If someone have abnormal glucose tolerance test, they check his test with a sugar drink and his sugar was slightly high. That's an indication to do a screening test later on. So how we can prevent diabetes? Anybody knows here what we can do besides this? This is the most important, the first 3 here. Diet, weight loss, and exercise. They say if you lose about 5 to 10% of your weight with diet and exercise, you cut down your chance of having diabetes by 60%. It's much better than any medication in the market, because there is no medication in the market approved by the FDA to prevent diabetes. We've been using some drugs like metformin, is very popular, Actos. It may be used, but it's not approved by the FDA, because they are not even better than diet and exercise. Still, diet and exercise and weight loss is still superior on medication. But sometimes we give it because we need to promote some weight loss, encourage patients to bring their sugar down. Because, I mean, how many patients can lose 10% and keep the weight off? It's really, you have to be motivated patient. So always, or many times, if someone cannot do this, we add medication, especially metformin. Why we like metformin? It's cheap, it's free even nowadays. It costs $4, it's been in the market over 20 years. And even recently now, it showed that it can prevent even cancer. So it's a good drug, it's cheap, so we like to give it if we have failed with diet and exercise. Yes?
Is there such a thing as like if you've already been diagnosed with type 2 diabetes, can you ever cure diabetes or just
No.
get it under control?
No. Once you have diabetes, you have diabetes. That's why we have someone, we diagnose them with one test, we repeat the test again to make sure. Because we don't like to miss, just diagnose someone with diabetes and then we mark them as diabetic for the rest of their life. So most of the time we do the test at least twice to confirm it. But no, once you have it, you have it. Now, it can be controlled. Yes. So pre-diabetes, they have a presentation, I think you have session every month here about pre-diabetes. It's from the name, pre-diabetes, so it's a stage between normal and diabetes. Why it's very important? Because these patients are very high risk to develop diabetes in the next few years of their lives if they do not really take control of themselves. It's asymptomatic, the sugar is slightly high, but not high enough to be diagnosed as diabetic patients. Most of these patients usually are overweight or obese, and they have risk of having heart disease, high blood pressure, high cholesterol, and even cancer. So it's very important to diagnose this patient early, start treating them early to prevent diabetes and all these complications. Yes, if you ask me why I mention cancer, because we know overweight and obesity is a risk factor for cancer. So it's very important to lose the weight. There's estimate about 41 million people have this condition in this country. So you can imagine how many. Almost everybody you know probably will have it. And again, what's the treatment for it? Diet, exercise, some weight loss. So we're not looking for someone is 200 pounds. All what we're looking for them to lose 15 pounds. That's very good for their health, maybe not the look, but the health. So all what we're looking between 5 and 10% weight loss. And if you think about it, it's not really that much for these patients. But if you're looking for the look, that's a different story. My focus here is on the health. So losing this few pounds, it can make a dramatic change in the health. Of course, if you're a smoker, you need to stop. It's very important. Smoking as serious as having diabetes.